Hello doctors, welcome to the second year FMT lecture. So today we are going to discuss about ergot poisoning. So it is a sclerotium. What is sclerotium? It is a parasitic fungi called as Claviceps purpurae. This Claviceps purpurae grows on the field of wheat. It infects the wheat and the infected wheat digested by a human or a person causes ergot poisoning. There are so many toxins in the ergot, but the three main toxins or active principles which causes the sign and symptoms of ergot poisoning are ergotoxins, ergotamine and ergometrin. The signs and symptoms of acute poisoning are irritation of throat. Now imagine a person ingests a poison, it goes from mouth directly into the throat. So it causes the irritation of throat, dryness. The dryness eventually leads to intense thirst. It also acts on the muscles, throats, then come to the muscles, tingling, convulsions, drowsiness, fatigue, then sensation of dizziness, sensation of cold, numbness, leads to madness, and nausea, vomiting, diarrhea, which are common symptoms in every poisoning. So these are the acute poisoning symptoms. Then comes the chronic poisoning. The chronic poisoning again classified into the convulsive symptoms and gangrenous symptoms. The convulsive symptoms, it disturbs, it deranges, it acts or affects the CNS, central nervous system, in which the sensation of ant creeping under the skin. The patient feels the sensation of ant creeping under the skin. Involuntary tonic muscle contraction and spasm, which leads to madness. Okay, muscle contraction and spasm. Tonic means fast. There are fast muscle contractions. So gangrenous symptoms, gangrene of feet, fingers, toes, ears, etc. In this gangrene of feet, suppose the gangrene of finger, then this gangrene of finger we can found the particles of sclerotium. This sclerotium particles can found in gangrene and can be found in stomach also, which causes diarrhea. So let's jump on the fatal dose and fatal period. Fatal dose is 1 gram or can be lower than 1 gram. Fatal period is 24 hours or lasts for several days. Treatment: stomach and bowel wash. Stomach is emptied from poison. Stomach and bowel wash can be helpful for this ergot poisoning treatment. Vasodilator can be helpful. So this ergot causes vasoconstriction. It constricts the blood vessels. So the pulse rate, heart rate is also increased. It can be added in sign and symptoms. So for their treatment, vasodilators can be helpful. Medico-legal aspect. For the acute poisoning, it produces from overdosing of abortion. So this ergot is used for abortion, but if eventually the overdosing is occur during abortion, then it causes the acute ergot poisoning. Then comes the chronic ergot poisoning. Ingestion of ergot containing bread for the longer period. If the infected wheat by the ergot, it comes in factory and the bread is made from this ergot infected wheat. The person digests it for the longer period, it can cause them chronic ergot poisoning. It was common. It is not now common now. It was common in European countries where it called as bread of madness. Hope you all understand this topic, ergot poisoning. So thank you.